everybody. This is Chris
and Cathy.
We wanted to take a minute to thank you all for tuning in. We appreciate every listener and are grateful for this platform.
Please help us share our vision by subscribing to our show through your favorite streaming app. Follow us on Facebook, Instagram, TikTok, and YouTube at PetAbility Podcast.
Check out our ever-growing list of affiliates and sponsors. Simply go to the show notes for information and links.
And be sure to use our promo code PETPOD22, that's PETPOD22, on checkout to receive your discount from our affiliates. And now, here's a word from our sponsor.
Hi, I'm Alon Landa, CEO of MedcoVet, and I'm a proud sponsor of PetAbility. We decided to partner with Chris and Cathy because, like them, we want to empower all pet owners who are trying to do the most for their pets. At MedcoVet, we specialize in advanced home laser therapy for pets. Laser therapy is a safe and effective treatment for common conditions like arthritis and wounds, and it relieves pain for most conditions caused by inflammation. With MedcoVet, pet owners can perform this treatment at home while receiving support from experienced clinicians. If you think your pet would benefit from healing at home, visit medcovet.com, and one of our clinical experts will work with you to determine if home laser therapy is the right fit for you and your pet. Tell them PetAbility sent you.
Groomers want their dogs to be happy as well. And so if they're dealing with a dog that had a really bad experience early on, they're dealing with that for the rest of the dog's life.
Welcome to PetAbility. I'm your host, Cathy Simons, certified veterinary technician, certified canine rehabilitation practitioner, and certified hospice and palliative care technician for pets.
And I'm your host, Chris Cranston, licensed physical therapist and small animal physical rehabilitationist.
Our podcast provides interviews and information to help your pets live their best lives.
Good afternoon, Chris. What's going on over there today?
Hi, Cathy. It's interesting because we're actually recording on a Sunday and we rarely record on the weekend. So this is a little bit out of the box, but we really, really wanted to get this guest in. So I will just get to it. How does that sound?
Okay.
So how this guest kind of fell into my lap is that I was actually at my dog's veterinarian for a wellness appointment. And I had a wonderful interaction with an employee there named Sophie Wasniewski. Why I engaged her in particular was that there was a new sign at the front desk that said that our vet, my vet, is now offering sedated grooming. And I really didn't know what that was. I mean, being a small animal physical rehabber for over 20 years, I knew that some pets would go to the groomer for, let's say, sani cuts if they couldn't groom themselves adequately. If they're a long-haired breed, whether it's a dog or cat, that would be very, very helpful. And then I've seen some things online regarding, these dogs that don't allow grooming and may need to have a specialized groomer or maybe something to relax them, like trazodone to get through it, and they're just this big furry matted mess. I mean, the owners can't even brush them, and so they're full of fur and they need to get that undercoat out. So anyway, Sophie and I started talking, and I was so impressed by her knowledge and why they are offering this now at Sleepy Dog Vet.
Yeah, I have a couple of things to say about that. One, you and I always talked about the importance of grooming for animals because from our perspective as rehabbers, dogs that are matted, dogs that are heavily matted, it affects their mobility and it's painful. And so that's always on our alerts, mobility and pain, right? And so it's important to get your dog groomed or groom your dog and your cat. And so we did a show with our friend Megan Terwilliger. She's a fear-free groomer.
Yeah, and Sleepy Dog Vet, just to put in a little plug, is a local vet to us, and they're integrative and offer a lot of holistic as well as more conventional medicine here in the States. So it's a combo. That's another show we did with Dr. Beth, is the difference or maybe even similarities between Eastern and Western medicine.
Most recently, we did one on dentistries with Dr. Beth. So I would say go back and listen to that one as well.
All right. Well, Sophie Wasniewski, welcome to the show. We're so excited to hear everything you have to tell us about sedated grooming.
Welcome, Sophie. Welcome to the show.
Thank you so much. Thank you for having me.
We could start, Sophie, with you telling us, how did you get into this? How did sedated grooming draw you in?
So I've been working with dogs since I was old enough to work. And so I was a local dog sitter growing up. And when I was in college and when I was home, I would work at, I don't know if people who are local here know what the laundromat is. It's like a bring your own dog, self-service bathing and drying station. And so I was a tub attendant there and did retail. And then I worked at daycare at Crate Escape in Charlestown. And I was looking for a job just to figure out what my next move was. And I landed at a daycare out in Waltham, and I was there for quite a few years. And then the pandemic hit, and a lot of people were getting dogs, and a lot of those dogs needed to be groomed because of their complex coats. And I was like, this feels like a good opportunity to try grooming. And then about a year ago, I ventured into vet med as sort of just my next step. And I wanted to bring grooming services into Sleepy Dog. Like you said, Cathy, I thought that was a wonderful point, that poor grooming affects all of their health holistically. It affects their mobility. You know, when you have a matted coat, there's not a lot of dead air space, we like to call it. So there's not a lot of oxygen getting to the skin. It can cause a whole load of problems if dogs aren't being groomed properly. So I thought it was an exciting opportunity to bring that to the clinic. And yeah, we're hoping to get some dogs in for some sedated grooming.
So you're also a fear-free groomer, though.
Yes.
Like we mentioned that, Megan Terwilliger is. In a nutshell, if folks don't know what that means, can you quickly define fear-free grooming?
Yeah. So fear-free grooming, it's a certification that you can get. You can get it as veterinarian, vet support staff, basically anyone working with animals, specifically dogs and cats. You can get a fear-free certification by taking this course. And it basically aims to evaluate fear, anxiety, and stress levels, which is where we refer it to as the FAS score, which is fear, anxiety, and stress. And so it basically teaches you how to evaluate body language, behavior from a cat or a dog to then help figure out where to go next. And we want to avoid any fear and anxiety. Obviously, stress is something that can come in any kind of setting where you're at the vet or at the groomer, but we want to mitigate those levels as best as we can to make sure that grooming or vet visit or whatever you're bringing your dog or cat in for is stress-free, and we keep the dogs or the cat's behavior and emotional state in mind so that we can proceed better. And we just don't want to traumatize the dogs and cats that come in, because a lot of dogs, especially dogs with complex coats, they need grooming every 6 to 8 weeks for the rest of their lives. So if they have one bad experience when they're a puppy in their formative stages of development, doesn't set them up for success moving down the road. And it further impacts the groomers too, because groomers just want their dogs to be happy as well. And so if they're dealing with a dog that had a really bad experience early on, they're dealing with that for the rest of the dog's life as well.
It provides a path forward, but sometimes that path forward may be stopping.
Exactly.
You abort mission and try again.
Yep.
Maybe with a different strategy or something like that. So always keeping the emotions of the pet that you're working with top of mind and what is best for them.
Sedation is part of the process of fear-free, right?
Mm-hmm.
Sometimes we need to mitigate that fear. Sometimes that is by giving sedation. So maybe clients have the misconception that sedation is for punishment because their dog is either rowdy or aggressive, but it's not. It's about mitigating those emotional responses for these patients. If I sedated a dog and I can get this done in 30 or 45 minutes, but if I have to spend 4 hours with a fearful dog, that dog's going to remember that for a very long time. And that breaks down and erodes at the human-animal bond relationship. I want to have a relationship with my patients. I want them to not fear me. I want them to get excited when they see me.
Right.
And if they become sick, I want them to be able to trust me. So sedation is actually part of, in some cases, part of the fear-free experience.
Yeah, that's a great point.
But let's get into that a little bit more, because until I talked to you more in depth, Sophie, I didn't really understand what sedated grooming is. I mean, Are they completely knocked out? Are there various levels? What exactly is happening? How does sedated grooming differ from what most people would picture as regular or more traditional grooming?
A lot of dogs come in for grooming on what like gabapentin and trazodone, some like that's a more mild sedation to help sort of mitigate their stress levels and sort of sedate them a little bit, but they're not completely knocked out. Sedated grooming, what we're offering at our clinic, they would be completely put out and under more heavy sedation, like whether it's like an intramuscular injection of something more strong than just gabapentin and trazodone. Because unfortunately, a lot of dogs are so fearful of the whole process that they really need to be unconscious for it. As much as I'd love that not to be the case, and everyone would be happy to be groomed or seen by a vet. Unfortunately, that's just not the world we live in. So we need to figure out how to provide compassionate care and take care of the animal's health at the same time. So that's where sedation comes in, is if a dog is too fearful, even with GABA or Traz on board, and they're still showing signs of fearfulness and reactivity, we also need to keep in mind the safety of who's ever treating the dog or cat as well. But sometimes a dog can just get so worked up that sometimes you miss those warning signs because they already have come in such an elevated state of fear or anxiety or arousal. That sedation is really about the safety of the practitioner and the pet, because we don't want to put a dog in a situation where they'll have a strike against them just because they've had a traumatized experience in the past.
Right. An analogy that I thought of as you were talking, Sophie, is, many people I'm sure can relate to a fear of going to the dentist.
Exactly.
And they also offer sedated dentistry for that very reason. And people are like, knock me out. I can't even stand the sound of the drill or the smell of the dentist office. Right. I mean, there's such a phobia there.
All of those things are embedded in your nervous system after one bad experience. No matter how many times you can consciously say, I'm not scared of this, it lives in the body until we really figure out a way forward through desensitization and stuff. So sedation helps with that.
Sophie, what types of pets typically need sedated grooming and why? I mean, we did talk about the fear aspect of it, but there are other reasons, right?
Yes. So also to clarify, with sedated grooming, at least what we're offering at Sleepy Dog, it really involves a shave down. So doodles, coats that get really matted really quickly, or cats like a Maine Coon, they can get matted pretty quickly, especially as they get older and they're not able to groom themselves as effectively. That can be super helpful. Unfortunately, under sedation, we can't really give a dog a bath and a blow dry because they can't thermoregulate with all those medications on board. So really, when we're talking about sedated grooming, I'm talking specifically about the haircut aspect of it, especially because the clippers, they make a loud noise. It can be really arousing for a lot of patients, and it can really freak them out. And if they're moving all the time and you can't get them to settle on a grooming table, that's not safe. These are electric clippers. You have to be safe while using them. You don't want to accidentally cut your patient on the table. So I would say dogs with extreme stress around grooming, that even with GABA and Traz on board, it's still too much for them. Another great candidate would be an elderly cat or an elderly dog that can't tolerate grooming the way that they used to. And some dogs with mobility issues, if they can't stand up, you know what I mean, and they're getting older, as long as their blood work shows that they can tolerate the sedation, those would be great candidates for that as well.
And pain.
Yeah, totally.
Because I'm a rehab person, I always go right for the pain.
Absolutely. Yep.
Some patients can't stand for the entirety of the grooming because it's simply too painful for them.
Here. In my 20 plus years of doing rehab, there have been so many times where the pet parent and I would talk about, and they know, there's a need for grooming, and they're like, my groomer won't take them anymore.
Yeah.
Because maybe it's a busy grooming facility and they have a system, and it's kind of like I'd say like an assembly line, right? And you can correct me, Sophie, but a bunch of dogs come in the morning and they go through their stations of bathing and blow dry, and then they get the primary cut, and then they get the finishing cut, and then they get their little, frou-frou smell goods and bows.
Right.
And this isn't that. And I would often talk to them about, if you really like your groomer, can you talk to them about even paying more in order to maybe come in first thing in the morning or at the end of the day?
Yep.
They treat your dog from start to finish and allow breaks where they can lay down and rest and get and decompress and get a drink of water and things like that. But traditional groomers often, that's not their model, and they can't make a lot of their living, doing that. But there is such a need for it. And so this would be the alternative. This would be the next step when you get to that point with your pet. And before we came on the show, Sophie, you mentioned that a lot of vet practices do offer something similarly. And I didn't even realize that.
It's not something they necessarily advertise. It's sort of like their client comes in and they're sort of like, hey, your dog is pretty matted. We do offer sedated grooming here if that's something you'd be interested in. And so they do offer it at other clinics. I just don't know how much it's being advertised. I'm happy to advertise it at Sleepy Dog because I'm comfortable grooming. A lot of vet techs don't go into, or veterinary support staff, they don't go into vet med thinking I'm going to be grooming, Right. So with my background in grooming, I am more comfortable with clippers. I'm more comfortable with different blade sizes. I'm more comfortable assessing the coat and what it needs, how short I should go, how short it needs to go. And sort of the dexterity with the clippers, all sort of, you learn along the way. That's why I'm happy to advertise it at Sleepy Dog, because I'm comfortable with my skill set in grooming because I had at least 5 years plus before going into vet med. So I'm a little bit more comfortable with sort of the technique of it all.
Can't tell you how many times I've seen, because a pet can't go to the groomer anymore, or the groomer won't see the pet anymore, that the owner has taken on the challenge of grooming their pet. And the likelihood of the pet getting injured is significant.
Very high.
It's very high. And they end up in the veterinary clinic because now they accidentally cut them with a pair of scissors or clipper burn. And so
that
there is
further adds to the trauma of the grooming experience.
It just piles on the trauma.
Exactly.
So I think this is a great option for clients, who are like, I can't get to the groomer, but also I shouldn't do it myself because I could get hurt or my pet could get hurt. Yeah.
Yep.
Well, and again, that association, like you as their owner advocate, you don't want to be associated with a negative experience.
Totally.
Try not to. Yeah.
So separating yourself from that and recognizing when you may need professional help, that is so much more efficient. I've had pet parents that I'm able to cut one toenail a week.
Right. And that's great. That's great. Baby steps. And I like to end on a good note. So if I try and tell people that if they're determined to try and do nail trims at home to save money or just to have a new skill set for themselves and do something with their dog, I try and tell them, don't get so attached to the results. Like a lot of people want to do the whole nail trim all in one go. Don't put that pressure on yourself and don't put that pressure on your animal, because that often won't be the case. And you'll stress them out more. You can do one nail. That's incredible. Give them a treat, go play, and come back to the rest later.
Can we talk, Sophie, about the haircut itself? Because when we're talking haircut, I don't want clients to think that they could come in with their dog or cat that needs to be sedated and request something like a puppy cut or a poodle cut or a high top or whatever they call them. We're talking about, fairly basic haircuts for these dogs. It's for medical and hygienic purposes.
Yes, great point. So it would be what a lot of people refer to as a shave down. It's just a clipper cut. So a lot of times with clippers, when you're seeing these fluffy dogs, they're being cut with a clipper, but the clipper will have a guard comb on it, anywhere between like 1/2 inch to 2 inches. So they're still getting a clipper cut, but it's with like a 2-inch buffer between the blade and their skin. So when I'm doing a sedated groom, it would be a full shave down. That way it's a maintenance cut. So like I was saying before, when you are coming in for a sedated groom, you are sacrificing aesthetics. You're not there because you want this beautiful show cut on your dog. You're doing it because your dog is so distressed in a normal grooming environment that they can't tolerate these kinds of haircuts. And all of these really involved haircuts, that's more time on the grooming table. That's more time for stressors to occur. So when you're under sedation and you're doing a sedated groom, you're really doing the most like sort of a bare bones, just a shave down to make them comfortable, to get airflow to their skin, I like to call it a maintenance cut, because If your dog is super stress grooming, you don't want to have to bring it in every 3 weeks. Whereas depending on the coat, depending on the age, how quickly the coat grows, if you're doing a shave down, sometimes that can last 3 months. So that sort of lessens the need for them to keep going back more regularly if they just have just a shave down every few months.
I was going to bring up that point because I assumed that you try to go, just by the term when you say shave down, as short as you can safely.
Absolutely.
To minimize the need for this frequently.
Absolutely. I'm not going to shave it as close to the skin in the winter as I would in the summer. You know, I like to keep maybe like a couple millimeters longer in colder months. Again, this is also after like we appraise the coat. So let's say that it's so matted to the skin that I don't have a choice but to use a 30 blade. And for those who aren't familiar with blade sizes, that's the shortest you can go. Sometimes I don't have an option other than to use a 30 blade because they're so matted to the skin, or what we call cast matted. But if that's not the case and I have a little bit more room between the coat and the skin, then sometimes I can go a little bit longer if the coat will allow for that.
Remember when we were kids and the summer would come and all the boys would go get their buzz cuts, like they'd all get the buzz cut for the summer.
Yeah,
I think we're aging ourselves, Cathy.
Maybe we are, Chris. Maybe we are. But the kids, all the boys would get the buzz cut for the summer and their hair would grow back by September. But that's what it makes me think of.
So if you mentioned a 30 blade and that's the shortest you can go, for those, again, that have maybe never had their pet groomed, doesn't it go backwards in that the higher the number, the shorter the blade? So it's kind of counterintuitive because
great point.
Yeah, I've walked in. This was a dog, my first dog that I ever had that was my own and not a family pet. And I remember getting her groomed and they're like, okay, so you want it pretty short. Do you want a 3 or a 5 or something like that? And I'm like, I don't even know what you're talking about and which one is shorter. You know, I probably would have answered the wrong way. So yeah, can you explain that?
Yeah. So for blade sizes, so the blade is what's going on the clipper. And then on top of that, you can have guard combs, but I'll just walk you through the blades first. So there's the 30 blade, which is the shortest, like I mentioned. There is a 40 blade, but I do not use the 40 blade unless it's in between paw pads or getting sort of all of those ones where you need a little bit more precision or a closer cut to get some airflow there. But so it goes from a 30 and then it goes up to a 15 and then a 10 blade. And then on top of, you can put a guard comb on top of a 30 blade or a 10 blade. I usually do that depending on like if they wanted a little bit shaggier.
Sophie, I'm really interested for you to walk us through the process. So, you know, what happens during a sedated grooming? Who's involved? The veterinarian, is the technician, the groomer? What kind of sedation are you using and what level of sedation are you using to ensure the safety of a pet?
You'd come in for an initial visit or initial consult and we'd get some blood work done to see that you can, or your pet can tolerate being under sedation. Once we get that information, a veterinarian on the case will prescribe the dosage and the type of sedation. It would likely be an IM injection, meaning intramuscular. So we'd stick it somewhere like around their rear, and we would have either the vet tech or myself, because I am part of the veterinary support staff, we would monitor the dog while it goes under, because it takes a little bit of time depending on the dog, the weight, the dosage. That all depends on like the quickness that the dog goes down. So we obviously want to monitor the dog while it goes down and while it sort of becomes unconscious. And so after that, we'd sedate the dog. They'd be on the table and we'd have another vet tech with me to monitor the dog's heart rate, pulses, whether that's with a stethoscope or we have like a little EKG machine that we can hook up that Dr. Beth uses while they're under anesthesia for dentistry. And after that, once we know that the dog is fully down and I have someone with me to monitor their vitals at the same time, I'll start just sort of starting giving the haircut. And so what I do is I'll focus first on the mats or the areas of heavy matting, just so I know that I get that out of the way in case, let's say, the dog or cat, for whatever reason, wakes up. At least I know that I got what they came in here to get done. That's been done. So I'll get the mats out and then I'll move on to the rest of the body. I usually do the body first, like the torso, the shoulders, the chest, and then I will move on to their legs. And I also tend to do nail trims in the beginning too, just to make sure that they're fully sedated and while I'm doing their nails, because paw handling and nail trims are really stressful for a lot of patients. So I want to make sure that I get that done as well. So I'll do, and I like to use a Dremel as well, which can be a little bit scarier because it's more stimulating, it's loud, it feels different. It's not just like a nail trimmer, it's like a rotary tool. If you're not familiar with what a Dremel is, it's like a rotary tool with a little spinning, it's got like sandpaper around the sides. So it helps sort of like shave down the nail. And I find that dremeling a nail lasts just a little bit longer than trimming the nails. And it also buffs them a little bit more. So, a lot of people complain after their dog or cat gets a nail trim that, oh, the nails are still sharp. And it's because we just trimmed them and they still need to wear down. So dremeling helps sort of buff the nail a little bit so that it's not as sharp. So I'll do the Dremel, I'll shave out the mats and then do the rest of the haircut. I'll do a sanitary trim, so around their private area, around their bum. And then I also like to do in between the paw pads, especially for dogs with complex coats, like a doodle or like a Maine Coon, where they have what I call the grinchy paws, where their hair is like sort of coming out. I like to do that because also, especially in winter months with all this, or in spring when the ground is a little bit more moist, there's snow, there's salt, there's mud, all that gunk can get in between the paw pads. And so that can cause matting too. So I like to make sure that those are clean, there's airflow there, especially because a lot of dogs have allergies that manifest in their paws or around that area. So I like to make sure that there's a lot of free flowing air to those areas. And then also, if your dog needs ear plucking, I don't love doing ear plucking unless it's veterinarian recommended. So those are usually only for dogs like poodles or for dogs with like hair instead of fur. So dogs that don't shed versus shedding. I like to pluck their ears if I really need to. That means that the hair is so overgrown in the ear canal that I can't get cleaner in there. Or let's say there needs to be a medicated prescription for like an ear infection. You need to make sure that the medication can actually get inside the ear canal. And if there's too much hair or that hair gets matted, then you can't really, whatever medication you're using can't really penetrate the ear canal. So I like to clean up the ears. If a veterinarian recommends that they be plucked, I'll do that. And then I'll clean the ears as well. And then I also like to do, again, you have to be very careful with this and it's easier under sedation. For dogs with hair, like a poodle or a doodle, I like to shave around their lips, especially in the back towards their molars, because that long hair can get wrapped around their teeth and that can attract more bacteria or more gunk there. So that just like is a nice little added touch to help ensure oral health as best as I can, is to just make sure that there's not any hair getting in the mouth. And so then after all of those things have been performed, we will administer a reversal sedation. So it's usually antecedent, anti-sedan. Some people say it differently. And we'll monitor them while they wake up. And I'll put a little bandana on them or a little bow tie if they have enough hair for me to put a little bow in their hair. And we'll put them in a kennel and again, monitor them while they wake up and just make sure that they're okay. We'll probably keep them for an hour or two after they've woken up just to make sure that everything's okay after they have been sedated. Call mom and dad up, say your dog did great, can pick up at so-and-so time, and let them know what to watch out for going home after being sedated and being groomed.
There's so many levels. I'm not a groomer, so I don't know exactly what goes into a sedated grooming, right? I mean, I've seen them, and when I was a younger technician, I'd seen them a couple of times, but not that often. From my perspective with my dog, I take him to our groomer and drop him off.
Right, exactly.
But he's been conditioned through fear-free grooming to actually be able to do that at this point.
Right.
If not, he may have been a guy who may have had to be sedated. I'm wondering if people out there listening are interested in, like, why is it important to do blood work ahead of time? Because I sometimes get pushback from clients who are like, but my dog's healthy. She had an exam. Do we really need to do the blood work? I don't want to pay for the blood work, but the blood work is crucial, right? Sophie, can you explain that a little bit?
For blood work, we're really looking to make sure that their organ function is okay and they can handle this heavier sedation. So that looking at kidney values, looking at liver values, looking at thyroid function. It's all really important when considering what kind of sedation and how much we can use or how much we should use. Your dog might not be a good candidate for that because we're not going to pump them full of a sedation if we don't think his or her liver can handle it.
Right.
You know, it's all about the safety of the dog. If their kidneys can't handle it, then they're just not a good candidate, unfortunately, because it all comes back to the safety of the dog. We're using heavier drugs, so we need to make sure that your dog's biosystem can handle what we're pumping into them. And it's all just to make sure that your dog is safe with these medications. And I know that it seems annoying for a lot of people, like, because blood draws, again, they can also be fear-inducing for some dogs. But again, it's really important that we have this testing done, because it would be reckless of us to just say, oh, sure, whatever you think, I'm sure your dog will be fine. You know, we're medical professionals here, so we really need to make sure that what we're doing is ethical and your dog can handle it, because God forbid something were to happen and we did not do our due diligence making sure that your dog would be safe during this procedure.
Right.
What's a typical statute of limitations? For example, let's say you got blood work at recent exam and you schedule the sedated grooming. If your pet had blood work within weeks, months, or do you require it immediately before the
That's
grooming?
a great question. So I think it varies from clinic to clinic. I know that at Sleepy Dog, when Beth does her COHAT, her pre-anesthetic blood work, she likes to have it done within 30 days of the procedure. And I worked at a clinic where they just needed 60 days ahead of time. It can vary case by case as well. Let's say it's an older dog who's a little bit less healthy than a young adult dog. We might want to see blood work a little bit closer to the time of the procedure, just to make sure that they'll be okay. If it's a younger, healthier dog, you could probably get away with doing it maybe 60 days beforehand. Again, the sooner to the procedure date, the better.
Yeah. And I think the bottom line is that this is veterinarian determined.
They're going to be the ones determining it, and they're going to be the ones using their expertise to tell me it would be best if this dog came in at so-and-so time to make sure that it's going to be okay for them, or they can handle it at so-and-so date.
As you were describing all the things from start to finish that a sedated grooming requires, the thing that popped into my mind is price point. This can't be so expensive that people are just like, I can't do it. I'm not going to do it.
Mm-hmm.
But yet hearing all of the steps, I'm assuming that it comes with a fairly hefty price tag. Do you have a range for folks? Again, keeping in mind that we're on the East Coast where a lot of things may be more expensive.
It would be somewhere between $150 to $300, depending on the size of the dog, the time it takes. So there would be an inpatient stay charge. The blood work would probably be, honestly, depending on the age of the dog and its previous medical history. The blood work can sometimes be more expensive than the service itself, depending on what your dog needs. But I would say anywhere between $150 to $300 for the service itself, excluding blood work. If you know your dog needs a sedated exam to begin with and they need a groom, that's a great time for us to do it all in one go.
I'm assuming that pet parents have to sign off on some sort of release. What kinds of risks are there? I mean, we've talked about the benefits and, which there are myriad. But bottom line, what are the risks involved?
There are some risks that can happen under sedation. Even with blood work, there are still a few flukes where the blood work doesn't show us something, and a dog, they could throw a blood clot or something like that under sedation or afterwards. Those are just some things that could happen that we are unable to predict. Also, sedation can be really upsetting to the tummy afterwards. So sometimes owners will report anything from inappetence, not wanting to eat, having diarrhea, vomiting, being constipated. Any of those things can happen afterward. And also some lethargy afterwards, some confusion, disorientation. They could feel a little bit more withdrawn afterwards as well. But, there's always a risk of something like cardiac arrest can happen. There's all of the same risks that happen with humans under sedation, dogs that can happen to them as well. And we do our best. That's why blood work is so important. Or let's say your dog has a heart murmur. We're going to want to see a recent echo within the last at least 6 months to make sure that your dog can handle that.
As you were talking, I'm all about the analogies. I was thinking, is this sedation similar to when I go for my colonoscopy?
Yeah.
So you're out of it, but you're not so deeply sedated. It's the time that's needed to get the procedure done.
Sometimes dogs, they can wake up a little bit and then we might need to administer some more sedation. Again, if they're waking up and we've given them the most amount of sedation that the veterinarian deems okay for them, then we'll have to stop. Unfortunately, we're never going to give a dog more sedation than its body can tolerate, even if that means that we couldn't get the service done. So it's a little bit different than when Dr. Beth does her COHATs, which stand for Comprehensive Oral Health Assessment and Treatment. It's basically a fancy way of saying a dental procedure, which involves ultrasonic scaling of the teeth to get tartar off. Sometimes that involves extractions if a tooth is dead. The sedation for sedated grooming is not as extensive as that. For Dr. Beth and her dental clients, they need to be under full anesthesia. They're intubated, they have the anesthetic gas, and so they're really out.
That's a good point, because I bet a lot of people up to this point maybe have imagined that, they have a tube down their throat or a mask over their face or what have you, but they're not hooked up to anything during this.
No, we just have like a little monitor that we hook up
monitor
to them to make sure, just to make sure that their vitals are okay. Again, a vet tech will be with me with a stethoscope to check their vitals to make sure that they're okay. But it's not the same as a surgical or dental procedure where they have to be intubated and they have to be under full anesthesia.
No IVs or anything like that.
No IVs, no.
Right.
Sophie, what would you recommend that these pet parents do in between grooming to help their dogs?
So in between grooming or in between these sedated grooms, a great way to help desensitize your pet to any of these tools is to start very simple. So some things you can do is if you have a nail trimmer at home, just leave it out. Leave it out where the dog can see it, leave it out where the dog can smell it, and just let them go about their business with this nail trimmer or this clipper or this Dremel or this pair of scissors out in somewhere where they can see it, and give them a treat for every time they, walk past it and don't freak out. You can do this for a few days and just desensitize them to being around it. And then the next step would be desensitizing them to being close to it. So one way I like to do this is leave a nail trimmer out on the floor after they've been desensitized to just the presence of it. I like to try and coax them with a treat. So I'll put a treat right next to the nail trimmer. And, if your dog is muzzle trained, you might find that this is similar to when you were muzzle training your dog. It's all about desensitizing whatever antecedent made them freak out in the grooming or veterinary environment in the first place. So you'll put a treat near the nail trim and just try and get them to get the treat next to the nail trimmer or the clipper or what have you. I know a lot of people don't have a clipper at home. Another thing that I tell them that they could use is an electric toothbrush because it's vibrating. But so you'll do some of those desensitizing activities, and when they're okay with being around it, then you'll move on to turning on the electric toothbrush when they're around and dispense treats at the same time. So they're used to the noise, because that's a lot of the times what freaks the dogs out so much, especially because their sense of sound is so much more sensitive than ours. The electric clippers can be really stimulating and scary. So I'll tell people to turn it on and give them treats. And then once they're okay with that, and you've done that for a few days, you can move on to just turning on the electric toothbrush. Or if you have a clipper at home, you can turn it on and then place the butt end of it, obviously not the clipper end of it. You can place the butt end on their body and still dispense treats. And you can move the clipper around their body to try and get them to be more desensitized to it, all at the same time as administering treats. And I cannot emphasize this enough, and on a good note. When your dog has done something good and you think that it's the end of the day, that's great. Pick it up another time, because the last thing we want to do is continue to distress them, because then they're just not going to trust us and they're not going to want to do this activity again. And you'll never be able to desensitize your dog to it. And this is also great to do with puppies as well. When they have no experience with these things, starting with a fresh slate is wonderful because they don't have any negative associations with it. So if you're getting a doodle as a puppy and you know that your dog is going to be groomed for the rest of its life, that's a great way to start. And then you can move on to when they've been desensitized to the noise or the presence of it. You can move to touching it on their, like, let's say you have a nail trimmer. You can move on to touching the nail trimmer to their nails, not trimming them, just touching the nails with the nail trimmer while dispensing treats. Try and do this when your dog is sleepy, because memory is reinforced through sleep. So if they feel safe and this is happening, they'll dream, they'll go through their REM cycle, and it'll be further embedded in their nervous system that it's okay, I'm safe, this isn't going to hurt me.
Very interesting.
That's interesting. Yeah, I wouldn't have thought of that.
As you were talking, a lot of my experience has been with dogs that are more feeble, right? Maybe they have neurological issues or orthopedic issues, or are very deconditioned due to injury or aging or whatever processes. But as you were talking about this desensitization, it really made me think about the puppy, the young dog, starting out the right way, because it's always so much easier. Any trainer will tell you this, to do it right from the beginning and be patient and invest in this. If you know your pet is going to need, this type of grooming and care for its lifetime, versus having to undo a negative experience. So, I would just also emphasize to people, to pet parents out there, to go slow. And like you said, end on that positive note. Any little step is a win, and it makes so much difference.
Yeah. And celebrate too. Like, your dog wants to make you proud. You want to show your dog that you're proud that they made this big step, that they let you just even have a nail trimmer in the same room as them. Give them a treat, play with them, celebrate that, and then move on to the next thing, take a break, and then pick it up another day, and your dog best. So if it's too much, listen to them and then take a break and come back on it on another day. And I guess I should correct myself. You made a good point. When they're puppies, it would be desensitizing them. When they've already been conditioned to be fearful, then what you're doing is counter conditioning them and creating a new relationship with them. Whereas desensitization is more when there's that clean slate and there's no prior negative conditioning toward whatever stimulant you're using.
You've referenced doodles a lot, and just piggybacking onto a recent show that we did with National Mill Dog Rescue. I think that a lot of these dogs that are in puppy mills, that is the one component that is always neglected, it seems, is the grooming. And all these little poodles and shih tzus and losses, and they would just come in so matted, and that's one of the first things they take care of. Cannot be overstated, the importance of this. Cathy, I think we've talked about this before, the stimulus of brushing, if they don't have an adverse reaction to it from a prior, negative association, that can be so therapeutic.
So part of your therapy plan.
You're stimulating.
It's lymph drainage. It's follicle stimulation. It's all of those good things.
Yes. And then, Cathy, you'll remember a dear friend of ours that we both treated, the big doodle Trio.
Yes.
And every time I saw Trio, he would be beautifully groomed. His coat was short. And I'd look at those doodle feet, like you mentioned, Sophie, and it was like I was excavating a treasure.
Yeah.
It's not a treasure. It's not a treasure.
I would spend extra time, and I would get the clippers because I was fairly comfortable with it. And I would get all kinds of things, debris, things that he had picked up in the woods, matted in there with mud. And, you think about way in the past, people built houses using mud mortar. Right. So this can be very intense.
Yeah.
And so, just little things like thinking ahead, soaking your dog's feet if they've been out, in a muddy environment, and just before it gets impacted, and the grass and the seeds and things like that, are also in there. And I mean, the poor owner, I would be like, wow, look at this. And she'd be like, wow, is it his foot? No wonder he was limping. And I also just wanted to caution people, we kind of blew by this, but don't use scissors with your dogs.
Yes, please. Thank you for saying that. Yeah, please don't.
Yeah,
do that.
it is really dangerous, and their skin can be quite fragile. And you think you're going after that mat, right, Sophie? And the next thing you know, you've cut a hole in your dog's or cat's skin.
Yeah.
So just don't.
Or ear flap.
Yep.
Yeah.
And then it's just so scary too. Like you don't want that for yourself. You don't want that for your dog, because then you're just going to freak yourself about the grooming process in general. And it might make you fearful yourself as a person of the
and then they feel
process.
your fear.
Exactly. It's like a constant feedback loop. We're constantly giving signals to our dogs without realizing it. And they're always going to be picking up on it. So if you're fearful around the grooming process, they're going to be fearful too. And it doesn't matter who was fearful first. You're both just completely feeding into it to each other through no fault of anyone. It just is the way our brains work. And so I think it's important to be mindful of your own mental state around it as well.
Exactly. Like if you're planning on doing one of these training sessions for desensitization or counter conditioning, make sure that you're in a relaxed state, that you have time, that you're not rushing through it, like, oh, I was going to do that, before bed tonight. Now I'm tired and it's already 10 o'clock. Then don't do it.
Yeah. Make it fun for yourself. Make it fun for your dog. You don't want to be super stressed and rushed through or you could something annoying could have happened at work. You're bringing that into your training session, and then you're getting frustrated with the result or lack thereof because you had this prior frustration from something completely unrelated. But the dog doesn't know that.
Right.
Yeah. And remember how intelligent animals are, our dogs and our cats, and it really probably would only take them about 2 times to make an association between an event, whether it was positive or negative.
I was just going to say, I know that we've been talking a lot about doodles, and I just want to make it clear, I have nothing against doodles. It's just, this is the designer breed, for lack of a better term, of our current culture. And so that's why I'm seeing so many more of them. I don't mean to associate any kind of temperament or behavioral trait to this breed specifically. I just have seen so many of them because they are the ones that need grooming the most, because they're so popular right now.
Well, Sophie, I hate to say this, but my dog's breed has been stigmatized.
Oh, yeah?
As far as nail trims go. And they make fun of it all the time on the internet with pugs getting their nails trimmed, because they make this weird Gremlins thing. But I think any dog, if it was given the right approach, could, with the fear-free model, learn to tolerate nail trimming. So sorry, pugs. I know you're out there being stigmatized for your bad nail trims, but my dog does it. Megan worked really hard to condition him to do it. And not only did she work really hard to condition him to do it, I've been forbidden to do it because she's afraid I'm going to ruin it.
There you go.
It can be done. It can be done.
Yep.
We've talked a lot about fear-free, and we also did an entire show where we interviewed one of the educators in the fear-free organization. So if you listeners out there are more interested in just learning about fear-free in general, please tune into that show. One thing too, I wanted to mention just before we close here is, you were talking about how close you cut them and things like that. Many dogs, especially as they age, also get warts, skin tags, cysts. And it could be hidden, right? Under their coat. And so having a professional do this because they are aware, you talked about, kind of assessing their coat beforehand. I'm sure you do a thorough palpation to screen for anything like that you need to avoid. Again, I've seen just by accident, many people cut off, something that shouldn't be cut off, or pull something off that they think is a tick and it's not a tick, it's a skin tag. So
right.
And It's a great opportunity. I'm channeling our friend Patty Ramirez here when I go, you know what, this is a great opportunity for the technician who's doing the grooming to check for lumps and bumps because we're getting down to the skin, right? And you could save a pet's life by finding something that might be, nefarious going on your dog.
Absolutely.
So.
And, especially if a dog is matted, we're missing a lot of data of what's underneath that coat, what's growing on the skin. And so when a dog is matted, you almost always will do a shave down before a bath. Whereas if a dog has a healthy coat with healthy airflow and no matting, you'll do a bath and a blowout beforehand. And the bath and the blowout is great because you can see the skin. You're splitting the coat when you're using the high velocity air dryer. When you're getting it wet, you have a better visibility of what's going on underneath that coat. When it's matted, you don't always have that because nothing will penetrate that coat because it's so matted. There's so much debris. There's so much dead hair in there. And so that's just another point to, brushing your dog is really important to get all of that, to just know your dog better, see what's going on under your coat. And that way you can come into the groomer and be like, hey, by the way, if you don't see this, there's X, Y, and Z over here, to be mindful of that. And then let's say your dog is under sedation and I missed something and accidentally nicked it. We're in a veterinary environment. So I have a veterinarian to come in and take a look and see if there's anything to be worried about. If they accidentally got cut, we're in the best place ever to address that issue.
I want to remind our listeners too that the skin is the number one barrier against any infection. So keeping the skin as an organ, because it really is a vital organ, healthy, is paramount. I actually had this experience personally. I got some matting because there were like hot spots due to allergies. I never experienced this before, under, and then the dog would lick and then it would mat the hair. And then, like you said, you create an anaerobic environment. There's no air getting to the skin. So then when I would like lift that mat and then there'd be this oozing, hot spot. I never had a dog with allergies before, and I learned.
Sophie, thank you. This was very enlightening, and I think it pairs very nicely with our other grooming show that we had with Megan Terwilliger. And I love that we were able to expound upon what sedated grooming is and why it may be necessary. Can you tell our listeners where can they find you, and how do they get in contact with Sleepy Dog Veterinary Clinic to get that initial assessment?
So I am at Sleepy Dog Veterinary in Arlington, Massachusetts, and you can email us. Our email is dreamteam@sleepydog.vet, and say, hey, I'm interested in sedated grooming. How do I start? And we can handle it from there.
If you want to learn more about some of the services that are offered at Sleepy Dog Vet, you can go to sleepydog.vet.
If you think that your pet could benefit from sedated grooming, you do have options, and now you will be informed and know the appropriate questions to ask when seeking this service. Yeah. So again, a very, very important show. Our goal is always to enlighten pet parents so that you can advocate for your pets and help them to live their best lives.
And if I could end on one note, I would just like to say that your groomer doesn't want to shave down your dog just for fun. If your groomer says that your dog needs to be shaved, unfortunately, they probably really do. They're not doing it to be a bad guy. They're not doing it to make you feel bad. They really have the care of the animal at the forefront of their mind. So I know that groomers can get a lot of flack that they shave down dogs constantly. And while that may be the case for some people, all the groomers that I've met, that has not been the case. And we really just care about the well-being of your dog. And if your dog is distressed in the grooming environment, and that doesn't make sense to you because your dog is perfectly happy at home, just try and recognize that you're often seeing your dog in a neutral state at its baseline. And when it's going into a stressful environment that you're not there to see, I would definitely take what your groomer or vet says into consideration regarding their level of fear, anxiety, and stress, because they're not doing it to make you feel bad. We really just want to make sure your dog is safe and happy and having a good experience.
Thanks, Sophie. I think that's the perfect way to end the show. Groomers want the best for your pet. Sure, they would love to give your pet the best, nicest, fanciest haircut, but sometimes that's not doable. Sometimes that's not appropriate. We have to think about the pet and the pet's emotional state.
Thank you so much once again, Sophie, for coming on and teaching us about sedated grooming. I wish you well in your endeavors. I hope you get a lot of business and can help more pets out there. So much appreciated.
Thank you.
Hi, PetAbility fans. This is your host, Cathy Simons. Do you live with a blind or visually impaired dog? Don't let vision loss stand in the way of a full, joyful life. In my book, Blind Devotion, Enhancing the Lives of Blind and Visually Impaired Dogs, I share my expertise and passion to help pet owners like you navigate life with a blind dog. From adapting your home to building trust and confidence, this book is your go-to resource for ensuring your furry friend thrives. Your dog's vision may be limited, but their potential isn't. Empower your dog. Get Blind Devotion today at Amazon.com.